Hello, microbiology friends. Okay, let's talk about the central nervous system and the peripheral nervous system, just so that we're all on the same page. Your central nervous system is your brain and your spinal cord. Okay, it's the processor of the information. So you see a bear, right? You see it, you're visually like, oh shit, that's a bear, or oh, what a fuzzy bear, right? You send that information to your brain, and your brain's like, let's go pet the bear, or let's run from the bear. Your brain makes that choice. So your periphery senses it, hot, sends it to the brain. Brain's like, take your hand off the stove, right? So your periphery both senses it and then creates the action that stops or starts something, right? I'm going to take my hand off the stove. I'm going to run from the bear. You have specific neurons in your eye that detect dangly things in your peripheral vision, which I think is fascinating. That causes you to freak out, because there's only one thing that dangles in your peripheral vision, and that's a deadly spider, even if it's not deadly. So it causes your central nervous system to be like, freak out! And you go, oh, like this, right? You move. Central nervous system processes. There's something dangly in your periphery. It's probably a spider. You should move your face. Okay? Central nervous system, brain, spinal cord. Peripheral nervous system, everything else. Okay? Just want to make sure we're all on the same page. Again, here's your cerebrum. This is your central nervous system right here. Now, you can bypass this a few ways. Mostly it's just like whacking your knee, whacking this part of your elbow, and seeing what your response is. That's actually to test your central nervous system and your spinal cord health. That's why we look at reflexes that way. Everything else is your peripheral nervous system. Okay. So again, structures of the central nervous system, your brain and your spinal cord. It's your thinking, your processing, controls also your involuntary movement, which is important. Your brainstem controls things like your breathing, your heart rate, your blood pressure, and it extends from your brainstem to your tail, your little tailbone there. Here again, central nervous system, we're going to have different areas of the brain. We will talk about those if they get infected. Okay, structures of the peripheral nervous system, cranial nerves, spinal nerves. Don't worry, I'm not going to make you memorize these. Sensory nerves towards the central nervous system. Motor nerves carry signals away from the central nerves. So your fingers touch the hot stove. It sends a signal to your nervous system. Now your motor nerves move your hand away, right? Some mixed nerves can carry things back and forth, but sensory senses. They're pressure receptors, they're heat receptors, they're light receptors. They're the receptors all over your body. They send things to the central nervous system. The central nervous system is like, run from the bear, move your hand off the hot stove. That's your motor nerves. Okay? Your muscles, things like that, contractions. Again, you have two basic types of cells. You have neuroglia, that provides support, insulation, nutrients. Then you also have, I'm going to move myself up here. Then you have neurons. These carry nerve impulses. As you know, there's ganglions, there's a cell body, there's dendrites that come. You have all kinds of fun neurotransmitters. This is just kind of a basic overview of AMP. You have a synapse, you have a postsynaptic cell. So you're going to exocytose some great neurotransmitters into a postsynaptic cell. There's going to be a synaptic cleft. It's going to give you electric signals. Your delightful neurotransmitters are going to be chemical signals between your synaptic clefts, and they're going to either be stimulatory, like run from the bear, move your face away from the spider, or they're going to be inhibitory, like, hey, what a fuzzy bear, let's rub the bear's tummy. Right? Don't rub a bear's tummy, but, you know, maybe it's a stuffed bear. Okay. Portals of infection into the central nervous system. Yay. What are our portals of infection? So the central nervous system is actually an axonic environment. Basically, it axonates bacteria. There is no normal microbiota in there. Like, no surprise. You don't want microbiome in your brain. Or spinal cord. No, that's bad. There are ways, of course, that you know, you can get bacteria or other nasty things into your central nervous system. You break a bone, you have a medical procedure, you travel from the peripheral nervous system to the central nervous system. Certain bacteria will do that. You infect and kill cells in the meninges caused by meningitis. Do you see how these things are named? Sometimes inflammation can alter the blood-brain barrier. That's, if you took anatomy and physiology, that again is the barrier that protects your brain. And there are certain infections that can get through that. And that, as you might guess, is not great. Okay, tell me why. Tell me why. Why is it important that cells forming the blood vessels of the brain and spinal cord be tight against one another, forming the blood-brain barrier? Why is the blood-brain barrier important? Da, 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 da. Okay, you can just press pause, and then I'll tell you. The blood-brain barrier prevents the microbes, especially large molecules in the blood, from entering the brain space. Essentially, it helps reduce fluctuations in the composition of the cerebrospinal fluid, which in turn protects the brain from homeostatic disturbances or organs throughout the day, such as vigorous exercise, such as if you get an infection in your nose, like right here, there's like, if your brain can actually leak out your nose. Yeah, it's only when you've had like some kind of surgery or something, but you can leak cerebral spinal fluid out of your nose if you've recently had brain surgery. So the blood-brain barrier is there to protect your brain from the rest of your body, or mostly from infection. Okay, bacteria cause disease in 2 ways. You should probably write this down. I feel like this is coming up on a quiz. Cells of the nervous system. 2 things affect cells of the nervous system, and there are different flavors of these, right? So, central nervous system, meningitis, and leprosy, right? Those are the 2 ways that you infect cells of the nervous system. There's sort of a bunch of flavors of meningitis. Also, there's bacteria that grow elsewhere that release toxins that affect the neurons. So, meningitis and leprosy directly affect your central nervous system. Botulism and tetanus release toxins that ultimately affect your neurons. Do you see the difference there? I'm definitely going to ask that on the quiz. Okay, bacterial meningitis. Good times. Let's see if it will let me play this lovely. Maybe. Oh.
Today's medical-centric topic is bacterial, viral, and fungal meningitis. Learn the difference. Meningitis, an inflammation of the protective membrane surrounding the brain and spinal cord, can be caused by bacteria, viruses, or fungi. While the symptoms may be similar, understanding the differences between bacterial, viral, and fungal meningitis is essential for accurate diagnosis and appropriate treatment. In this video, we will explore the distinctions between these types of meningitis, including their causes, symptoms, diagnostic methods, and treatment approaches. Bacterial meningitis, caused by bacteria like Neisseria meningitidis, Streptococcus pneumoniae, and Haemophilus influenzae. Transmission through respiratory droplets or direct contact. Symptoms: severe headache, high fever, neck stiffness, sensitivity to light, nausea, vomiting, and altered mental status. Diagnosis: lumbar puncture and laboratory analysis, cerebrospinal fluid. Treatments: antibiotics. Viral meningitis, caused by viral infections like enteroviruses, herpes simplex virus, and varicella zoster virus. Transmission through respiratory secretions or fecal oral routes. Symptoms: headache, fever, neck stiffness, sensitivity to light, fatigue, and body aches. Diagnosis: clinical evaluation, cerebrospinal fluid analysis, and viral testing. Treatment: supportive care, rest, hydration, and pain relievers. Fungal meningitis, caused by fungal infections like Cryptococcus neoformans or Histoplasma capsulatum. Primarily affects immunocompromised individuals. Transmission through inhalation of fungal spores. Symptoms and progression vary. Diagnosis: cerebrospinal fluid analysis and fungal culture. Treatment: antifungal medications. Differentiating between bacterial, viral, and fungal meningitis is crucial for appropriate management and treatment. Bacterial meningitis requires immediate medical attention and antibiotic treatment. Viral meningitis is typically milder and resolves with supportive care. Fungal meningitis is rare and affects immunocompromised individuals, requiring antifungal medications. If meningitis is suspected, seek prompt medical evaluation for accurate diagnosis and timely treatment. Early detection and proper management are vital for positive outcomes and minimizing complications. Thank you.
Okay, so what you probably got from that lovely video is that you are essentially getting a spinal tap if they think you have meningitis. So stay tuned for the next video, and we'll talk about meningitis.